Today we're visiting Full Circle, and we're going to be checking out some awesome physiotherapy techniques, and we're going to be learning about Bowen therapy. I've never heard about it, and I'm super excited to check it out. So come follow me. I'm here with Joyce, a physiotherapist at Full Circle.
Hi, my name is Joyce Clark. I'm a physical therapist here at Full Circle, a collaborative health approach. I love treating complicated problems so that we can come up with a really good plan for a patient, let's say, who has a neck problem as well as a shoulder issue and a jaw problem, and to really help them to feel better, ideally to decrease their pain and improve their function.
Joyce, pleasure to be with you. Why don't you tell me a little bit about physiotherapy?
Okay, well, physiotherapy is used as a tool to assess a patient's function and see how we can best enable somebody to return to the things that they love to do. So
if I have a little bit of pain, I would definitely want to come see you, hey?
Oh, absolutely.
Okay, wonderful. And what kind of patients do you normally treat here?
Well, we actually see a lot of patients with neck and back pain, knee and shoulder injuries.
Okay.
Really all types of joint injuries and problems.
Okay. So how about our particular patient right here?
Well, he actually has, what's fairly common is to have more than one issue at a time. So he's got a knee problem as well as a back problem.
Okay.
What I'd like to show you is that for his knee problem, first of all, what I want to do is I want to check if there's any swelling or any problem like that.
Okay.
This is an old problem, so there's no acute swelling. Now I'm just going to check the range of motion. So I go ahead and I do that. Okay. Oh, and he's got a little excess movement into extension.
Okay.
The next thing that I would be checking would be his ligaments. So when I check his ligaments, you can see that there, do you see how that moves?
Oh, a little bit of pull there. Wow. I hope that doesn't hurt our model. And our patient. You're good. Okay.
So there's a little bit of instability there.
Right,
okay?
Yeah, I see that.
And we were able to see that earlier on his movement patterns. So I also want to check out some other ligaments and see how those are doing.
Okay.
Okay. So if I just test the sciatic nerve here, you can see that he's got a little bit of extra tension on this side, which is how his back problem kind of ties in with his knee problem.
Oh, okay.
So in order to address this problem properly for Neil, we're going to need to be treating both his back and his knee at the same time. Okay.
Now we're in the exercise area here, and now Joyce is going to show us a couple exercises they do as a part of the physiotherapy, right? So what are we doing for Neil here?
Well, I'm going to get Neil onto the balance board. Because he's a boarder, we need him to be able to have good coordination so that he can return to his sport and not re-injure himself.
When he gets back to the X Games.
Yeah.
Okay, so let's...
go ahead.
Is this pretty hard to...
It is actually pretty hard.
He's doing a pretty good job.
Do a forward, backward movement. And he's going to try and slow down his movements a little bit so they're a bit more controlled, so that, you know, did you see how it was a little bit jerky?
Yeah, absolutely.
Yeah, so we're going to be working on that component in particular.
Hey, Neil, I'm dying. Joyce, can I give this a try?
Yeah,
this looks so awesome.
Okay.
I see how my balance is. All right. So, and I want to go slow. Is that right?
Yep.
Okay.
Wide stance.
Wide stance. Posture up.
Yep, there you go.
All right. This is a lot harder than it seems. And then side to side?
Yep.
Okay. So Joyce, how is my balance? Am I okay?
You're pretty normal.
Okay, I'm not much of a snowboarder. But yeah, no, this is great to definitely get your balance on check, on point. Okay, so Joyce, you showed us some amazing techniques to get rid of some aches and pains that you might have. What would you recommend in Neil's case and for anyone else maybe looking to get rid of that pain?
Well, in Neil's case in particular, we're able to utilize the other practitioners that we have here in the clinic so that we're able to really have a comprehensive management plan for him. Here at the clinic, we are able to treat a lot of conditions that are coexisting. So instead of just treating a knee problem, we're very happy to treat a back problem that has a knee component, or if somebody has a sore shoulder and then they've got headaches, we love treating that. I especially like treating jaw problems. It's a great place to come to.
All right, Joyce, well, I had a blast. This was awesome. Thank you so much.
Great.
I'm here with Shawna, a Bowen massage therapist, and I'm super curious, what is Bowen therapy?
Hi, I'm Shawna Ryan, and I am a Bowen therapist at Full Circle, a collaborative health approach. Bowen therapy is a neuromuscular release technique. By applying small rolling motions over muscles, ligaments, or tendons, it sends signals to the brain to release the dysfunctional patterns in the muscle tension.
Wow, okay, well, I'm dying to see this in action, so why don't we get started and let's check this out.
Okay, so our client here has low back pain.
Okay.
So I'm going to show you, this is the belly of the muscle, the erector spinae here. We're going to go in the belly of the muscle.
Okay.
We're going to take the challenge of the muscle, push in, and you roll over that muscle.
And that's painful at all? No, should be pretty good.
It should be pretty good. There's some procedures that are painful,
Yeah.
But I always walk through my clients and definitely stay within their pain tolerance. You never want to push into someone's body and make them uncomfortable.
Okay, and tell me, what is the difference between Bowen and just regular massage?
Massage is more of a hands-on modality where the person is rubbing, using lotions the entire hour.
Yeah.
Bowen therapy is a sequence of moves that I do over specific muscles, ligaments, and tendons. And so therefore, after I do the procedure, there's actually pauses built in. And those pauses are so important because they allow the body to integrate the effects of the therapy.
Okay.
So it's like if you have a computer and you overload it, and then you have to reboot it, it's the same with the body. So you want to be careful because it does affect the nervous system.
So can I try? Like, do you do it on my arm, or?
Yeah, I could do it on your arm.
I'm dying to see how this feels. Okay. All right. So is that good?
That was good. So if you have tight forearms, so I want you to relax your arm.
Okay.
Relax your arm.
Let's relax.
It's not.
It's not?
There
Okay.
you go. So if you're going to work the forearm, then you just take, again, the belly of the muscle.
Okay.
And you roll over.
Oh, whoa,
Oh,
whoa.
you got the effect that I wanted.
Is that what I want to feel?
That's what I wanted to feel. That was awesome.
That was cool, yeah.
So then you just carry on with the specific points on the elbow.
Oh, wow. Yeah.
Yeah.
Very interesting.
Good.
Very different. Yeah. And this can help with pain. It
helps with chronic conditions, acute problems. It can help with as far as a simple cold, as deep as having a car accident like myself.
Wow. And is that how you got into it?
That's how I got into it. Many years ago, I had several car accidents, and someone recommended this therapy to me when I was going through my treatments, and it was the one that really helped to relieve the pain that I had from my car accidents. I had a ton of whiplash in my neck. And
now it's gone.
Now it's gone. I'm more active now than I was back then, for sure.
Fantastic. Wow.
Okay, Chris, I really want you to feel what Bowen feels like. So I'm going to work a little bit on your neck and see how you feel, and tell me what you feel.
Absolutely.
So I just want to also, so you take the challenge of the muscle.
Oh, okay, I feel the pressure on it.
And rolling over that.
Wow, yeah, I know, it feels pretty nice.
So this is really good if you have migraine headaches, if you struggle with stress from work and you carry it all up in your upper back and into your neck. And just a reminder too that Bowen is great for all ages, from children, babies, all the way up to the elderly, because it's so gentle. You can use it on every walk of life.
I had a fabulous visit today at Full Circle, doing some physio with Joyce, and then learning about Bowen therapy with Shawna. I'm your host, Chris Khan with Fashion and Lifestyle. Thanks for watching.